burning, itching, tingling, or total numbness. Your nerves are sending you a message, but most people misinterpret the signs. Let's break down the most common abnormal nerve sensations, what they mean, why they happen, and which ones should never be ignored. Most of us think of nerves as simple wires, but they're actually part of a sophisticated communication network. When that network is working normally, you rarely notice it. But when a nerve is compressed, inflamed, damaged, or even regenerating, it starts sending signals that can feel like burning, itching, tingling, or numbness. Sensory nerves relay information from the body to the brain, allowing us to detect touch, pressure, temperature, body position, movement, and pain. However, when nerves stop transmitting signals normally, they may send abnormal or distorted messages to the brain, resulting in abnormal sensations and pain often associated with nerve irritation, dysfunction, or neuropathic pain. It is, therefore, important to understand the difference between normal nerve sensations and abnormal nerve sensations and neuropathic pain. Normal nerve sensations include touch, pressure, hot and cold, position sense, movement perception, and pain as a protective warning signal. Abnormal nerve sensations and neuropathic pain may include burning, itching, tingling known as pins and needles, numbness, vibrations, electric shock sensations, hypersensitivity, and exaggerated pain response. In this video, we'll explore these abnormal sensations and neuropathic pain, helping you understand what they may mean, what are the possible causes, and when they deserve medical attention. Symptoms and their meanings. Burning the alarm signal. This often suggests that pain-carrying nerve fibers are irritated or sending abnormal signals. It can occur in early-stage nerve compression, inflammation, or other conditions that irritate these nerve fibers. This type of sensation is commonly associated with neuropathic pain. The message is, the network is under stress. Itching, the healing signal. During normal wound healing, itching is often a positive sign that repair processes and nerve regeneration are occurring. It signals that your repair crew is active and that microscopic nerve fibers are being stimulated as new tissue builds and the skin stretches. The message is, the construction is underway. Tingling, known as pins and needles, the static signal. It is like the static you hear on a radio and feels like a prickly crawling sensation, like a limb waking up from falling asleep. It often suggests that a nerve is being temporarily compressed or irritated. The message is, the signal is partially blocked. Numbness, the silent cutoff. Persistent or worsening numbness is often considered a warning sign because communication between the nerve and the brain is being interrupted. The message is, the line is temporarily disconnected. Vibrations or humming, the hyperexcitability signal. This sensation feels like a cell phone vibrating under the skin. This may occur when nerves are irritated, hyperexcitable, or recovering. The message is, I'm recalibrating my sensitivity. Shooting, stabbing, or electric shock-like sensation, the reboot signal or pain. When nerves are irritated, compressed, injured, or recovering, they can sometimes produce sudden, sharp bursts of abnormal electrical activity. The message is, I'm trying to reconnect the power. Extreme sensitivity to harmless stimuli, the hypersensitivity pain signal. Extreme sensitivity, where normally harmless stimuli, like a light touch or a gentle breeze or brushing your hair, cause significant pain. This medical condition is known as allodynia, in which normally non-painful stimuli are perceived as painful. It results from a malfunction in how the nervous system processes sensory information and is a common symptom of conditions like fibromyalgia, migraines, and diabetic neuropathy. The message is, safe signals are being mistaken for danger. Amplified reaction to natural painful stimuli, the exaggerated pain signal. Hyperalgesia is an amplified reaction where naturally painful stimuli feel much worse than they should. For example, a minor injury or pinprick may feel far more painful than expected. The message is, the pain volume is turned up too high. So, while these sensations may sound similar, Each one can provide a different clue about what's happening within the nervous system. Let's take a closer look at when these symptoms are harmless and when they may signal a more serious problem. The never ignore signs. While many nerve sensations are temporary or part of the body's recovery process, certain patterns may signal a more serious problem. If you experience any of the following warning signs, seek prompt medical attention. Sudden total loss of function. The signs are, you can't move a specific muscle, or you suddenly can't grip objects or bear weight. The meaning is, this suggests a motor nerve or nervous system pathway may be severely compromised. Saddle numbness. The signs are, numbness affecting the groin, inner thighs, buttocks, or saddle area. The meaning is, this may indicate compression of important nerves in the lower spine and requires urgent medical attention. Loss of bladder or bowel control. The signs are, new difficulty controlling your bladder or bowels, especially when accompanied by numbness, weakness, or other nerve symptoms. The meaning is, this can be a sign of serious nerve or spinal cord involvement and requires urgent medical attention. Night pain that prevents sleep. The signs are, pain, burning, or electric shock sensations that are significantly worse at rest and repeatedly prevent you from sleeping through the night. The meaning is, persistent pain that regularly wakes you from sleep or prevents sleep deserves medical evaluation, particularly if it is worsening or accompanied by other neurological symptoms. Visible skin changes. The signs are, the skin over the numb or tingling area becomes shiny, loses hair, or changes color, becoming unusually pale or blue. The meaning is, this may suggest that nerve dysfunction is affecting the health of the skin and surrounding tissues. Rapidly progressive symptoms. The signs are numbness, weakness, or abnormal sensations that are spreading quickly over hours or days. The meaning is, rapid progression may indicate a serious neurological condition and should be assessed promptly. Remember, nerve symptoms are often temporary and harmless, but red flags involve loss of function, rapidly worsening symptoms, or signs that the nervous system is no longer communicating properly. What can cause nerve sensations and neuropathic pain? Abnormal nerve sensations and neuropathic pain are not diagnoses by themselves. The same sensations and pain can result from many different conditions, which is why symptoms should always be interpreted in the context of the person's overall health and medical history. A proper medical evaluation is often needed to identify the underlying cause, such as diabetes, the most common cause. Prolonged high blood sugar can damage delicate nerve fibers. Vitamin deficiencies, especially vitamin B12 deficiency, which is essential for healthy nerve function. Toxins and medications, including chronic alcohol use, certain chemotherapy drugs, and exposure to some toxins, can damage nerves. Autoimmune diseases. Conditions like lupus or rheumatoid arthritis can sometimes cause inflammation or damage to peripheral nerves. Injuries and nerve compression, like physical trauma, repetitive strain, or prolonged pressure on a nerve. Spinal conditions such as herniated discs, spinal stenosis, or other conditions that compress nerve roots as they leave the spine. A proper diagnosis for symptom management is therefore a necessary next step. Diagnosis and management of nerve sensations and neuropathic pain. If you're experiencing persistent or concerning nerve symptoms, a healthcare provider can help identify the underlying cause through a medical history, physical examination, and, when appropriate, diagnostic tests, such as blood work, nerve conduction studies, or imaging. Treatment focuses on addressing the underlying cause whenever possible. For example, improving blood sugar control in diabetes, relieving nerve compression, or treating vitamin deficiencies. Symptoms such as neuropathic pain may also be managed with medications, physical therapy, lifestyle modifications, or, in selected cases, nerve stimulation techniques. While many peripheral nerves have the ability to recover over time, the extent of recovery depends on the cause and severity of the nerve injury. If you notice nerve symptoms, 1. Observe the pattern. When did it start? Is it getting better, worse, or staying the same? Is it constant or intermittent? Is it associated with a specific position, movement, or injury? 2. Address common causes. Avoid prolonged pressure on nerves. Improve posture and ergonomics. Manage conditions such as diabetes if applicable. Follow wound care and rehabilitation instructions. 3. Know when to seek help. Review the red flags. Persistent symptoms deserve evaluation even if they aren't emergencies. Your nerves are your body's early warning system. Understanding the difference between temporary tingling, a healing itch, and persistent numbness is one of the best ways to protect your long-term health. Remember, nerve sensations are important messages, but they are not diagnoses. If symptoms are persistent, worsening, or accompanied by the warning signs we've discussed, seek medical advice promptly. If you found this video helpful, hit the share and like button so more people can learn to read the signals their body is sending. Subscribe for more insight into the physiological functions and anatomy of your body. If there's another health topic you'd like us to explain, let us know in the comments below.